We will start the class today, and the class for today is on hospital and its function and organization. So all of you have been to the hospital, you know what a hospital is? Yes or no?
Yes, ma'am.
Okay.
Yes, ma'am.
Yes, ma'am.
So we will start with a definition of a hospital given by WHO. WHO Expert Committee. WHO Expert Committee in 1963 defined a hospital as a residential establishment which provides short-term and long-term medical care consisting of observational, diagnostic, therapeutic, and rehabilitative services for persons suffering or suspected to be suffering from a disease or injury, and for parturian, that is for gynae and obstetrical problem. So it may or may not also provide service for ambulatory patient on an outpatient basis. So the WHO Expert Committee in 1963 defined a hospital as what? It is a residential establishment. That means a place where a people can live in or stay. And this place will provide a short-term and long-term medical care to the person or the patient, which consists of what? Observational. They may put the patient in a hospital only for observational purposes, or for diagnostic purposes, or for therapeutic purposes, or for rehabilitative purposes, depending on the need of the individual person or the patient who suffer from any disease, who suffer from any injury, or who suffer from any gynae and obstetrical problem. These hospitals, some of them may have an OPD or outpatient department, and some may not have an outpatient department. So depending on the organization. Another expert committee of WHO in 1956 defined the hospital as what? It is an integral part of social and medical organization, the function of which is to provide for the population complete health care, both curative and preventive, and whose outpatient services reach out to the family in its home environment. So the hospital is also a center for training of health workers and for biosocial research. The WHO Expert Committee in 1956 defined a hospital as an integral part of a social and medical organization, and the function of the hospital is to provide care to the population, that is to provide a complete health care, both curative and preventive, whose outpatient services reach out to the family in its home environment. That means it includes all. The preventive in the home, in the community, and the curative in the hospital. It is also a center of training of health workers like the nurses, the doctors, paramedical staff, and so on. And it is also a place where they carry out biosocial research. So next we come to the classification of hospital. Am I audible to you? Screen? Is okay?
Yes, ma'am.
Okay. If anything, you can stop me in between, okay? If you have any problem, you inform me in between. So the classification of a hospital. The hospital is being classified based on the objective, based on administration, ownership, control of financial income, and based on the length of stay of the people in the hospital, and also based on the bed capacity, on type of care, or on teaching affiliation, on based on system of medicine, on regionality, or according to WHO classification. So we will see this one by one. For the classification of hospital based on its objective is that it may be a general hospital which give care to all type of patients who suffer from various type of disease, injuries, or a special hospital which treat only for a particular case like a cancer hospital, a kidney hospital, eye hospital, and so on and so forth, and a teaching cum research hospital like what we are having here in NEIGHRIMS. It is a teaching cum research hospital. Then the next classification of hospital is based on administration. It is based on ownership, based on control of financial income. So we have a government or public hospital like the state hospital, Kanisdas Hospital, civil hospital, which is a government or public hospital, non-governmental or private hospital like Dr. H. Gordon Robert Hospital, Nazareth Hospital, then semi-government hospital, which may be shared by the government and the private sector, and voluntary agency hospital. So these hospitals are being based on their administrative control or under ownership control of that hospital. Then based on length of stay, it may be a short-term or short stay hospital in which people who are being admitted there can stay for less than 30 days, and long-term or long-stay hospital in which a person who were being admitted there can stay for more than 30 days. Clear up to here?
Yes, ma'am.
Okay.
Yes, ma'am.
Yes, ma'am.
Then next.
Yes, ma'am.
Okay. Based on bed capacity or the size of the hospital, it may be a small hospital up to 100 bed or 100 bedded hospital. Then a medium hospital which have 100 to less than 300 bed, and large hospital more than 300 beds like what we have here. And then based on type of care, it may be a primary care hospital where they give only primary care, then secondary care hospital, and tertiary care hospital. Then by teaching affiliation, it may be a teaching hospital which have a teaching institute for nurses, for doctors, paramedical staff, or a non-teaching hospital which have only for patient care. Then, based on system of medicine, it may be an allopathic hospital, it may be an Ayurvedic hospital, it may be a homeopathic hospital, it may be an Unani hospital or hospital of other system of medicine. Then based on regionality, it may be a regional hospital or it may be a district hospital. Then as per WHO classification, they classified the hospital into 3 types. That is the regional hospital which look after the whole region. Then the intermediate or district hospital which look only for the particular district, and a rural hospital which take care only for the rural population. So general hospital, as I've already told you, that they are meant to provide a wide range of various types of healthcare but with limited capacity. They care for patients with various disease conditions for both sexes to all ages, medical, surgical, pediatric, obstetric, eye and ear, and usually they are devoid of super specialist medical care. Special hospital, they limit. Another one we have is the special hospital. They limit the service only to a particular condition like orthopedic, maternity, pediatric, geriatric, and etc. Then teaching cum research hospital, like college is attached for medical, nursing, dental, pharmacy, education, and the main objective is to provide medical care, teaching, and research in secondary level. Then government or public hospital, they are owned, administered and controlled by the government. They provide free care for patients. The government hospital are owned by the Ministry of Health. Others, a public hospital or government hospital is a hospital which is owned by a government and receive government funding. In some countries, this type of hospital provide medical care free of charge, the cost of which is governed by the government reimbursement. Then we have a private hospital owned or controlled by an individual or group of physician or citizen or by private organization. Their purpose is to provide service for profit making. So these private hospitals, when they provide services to the people, or to the population, their main aim is to gain profit out of it, whereas the government, they are given free of cost. And semi-government, they are run both by the government and private entity, as I've already told you. Corporate hospital, these hospitals are public limited company formed under the Companies Act and run on commercial line like Apollo Voluntary Agency Hospital. Then short-term or short-stay hospital, a hospital where over 90% of all the patients admitted in such type of hospital, they stay less than 30 days. And long-term or long-stay, a hospital where over 90% of all patients admitted stay about 30 days or more, like in a mental hospital. Then closed staff hospital, the physician are held responsible for all medical activity in the hospital, including the diagnosis and treatment of patient, fee paying and emergency. Then open staff hospital, these are those hospitals which permit other physicians in the community to admit and treat patients to the hospital and treat them. So is it clear to you the difference between a closed and open hospital? A closed hospital are those hospitals in which the physicians who are working in that hospital, they are responsible for all the activities that they have to carry out in the hospital, and they will not admit or treat patients who are coming or who are being referred by other physicians. Whereas open staff, they treat all type of patient, whether it is by those from that hospital or are being referred from other hospital. Then according to level of care, primary care hospital is the day-to-day healthcare given by a healthcare provider. Typically, this provider acts as the first contact and principal point of continuing care for patients within a healthcare system and coordinate the other specialist care that the patient may need. It provides mostly basic health care. It's generally regarded as the gateway to receiving more specialist care. It may be the community health center or the primary health center which admit patients there. These are usually 50 to 200 bedded hospital, and it also includes divisional and national level hospitals. So in primary care hospital, they also include not only the primary health center, the community health center, but even the divisional and national level hospital, which have a bed strength of about 50 to 200 beds, and which provide only primary care to the people. But if a person needs a specialized care, they have to refer it to the secondary care hospital. Okay, then the WHO classification expert committee in 1957 about regional hospital, they say that these hospitals, they provide complex range of treatment and highly specialized services. So they serve as a larger area than a local hospital, for example, Government Medical College Hospital. Then intermediate or district hospital is a district hospital typically where the major healthcare facility is being provided in its locality. Specialty service will be given only for a major discipline like medicine, surgery, and gynae. And rural hospital, they are the remote hospital with small number of beds and limited service capacity of 20 to 100 beds. So these are the classification of a hospital based on the different thing. Any question from here? Up to here?
No, ma'am.
No.
No.
Okay, we'll proceed.
No, ma'am.
Okay. So we will proceed to the function of a hospital. Hospital administration function can be classified into three broad categories. Number one is medical, number two is patient support, and number three is administrative. So in medical, it involves treatment and management of patient through the staff or the physician. So in medical, that means it involves treatment and management of patient who come to that hospital through the staff who are working there and also through the physician. Then patient support, It relates directly to patient care and includes nursing, dietary, diagnostic, therapy, pharmacy, and laboratory services. And administrative concern the execution of policy and direction of the hospital, governing discharge of support services in the area of finance, personal, material and property, housekeeping, laundry, security, transport, engineering, and both under maintenance. So we see here that the hospital function, they are being divided into three broad categories. That means number one is the medical function. And in medical function, that means that the person who are being admitted to the hospital, we know that they will be treated and managed by the staff and physician who work in that particular hospital based on the need of the patient. And patient support, that means they are those people who work in the hospital and support the care of the patient directly, like the nurses, the dietary department, diagnostic department, then physiotherapy, pharmacy, laboratory, and etc. Then administrative is concerned with execution of policy and direction of the hospital which govern discharge of support services in the area of finance, personal, material and property, housekeeping, laundry, security, transport, engineer and board, and the maintenance. As you have seen here in our hospital, we have the hospital there where they give treatment and care to the patient through the staff and physician. Then the patient support, like we have the nursing department, the dietary department, diagnostic department, and so on. Then administrative, we have another block here, the administrative block, and this which concern on the execution of the policy, right from the director, deputy directors, and other office staff there, which look after to meet the needs of the hospital, like I have already mentioned. Then now come to the major function of the administrative service. This is the most important department in a hospital. Without administrative department, the hospital will not be able to function. Why? Because this department, it provides services which relate to accounting. That means financing, then billing, then budget, then cashiering, housekeeping, laundry, personal, property, supply, security, transport, engineering and maintenance, and it also renders support service to hospital care provider, clients, other government and private agency and professional group. So the administrative department or the administrative department is one of the most important department in each and every hospital, because this department, they have to look after everything which required for that hospital to be able to function in a proper way, right from budgeting, then from human resource, then from seeing that each and every department have enough supplies and equipment so that they can carry out the care. Then the next, the responsibility of the administrative, what are the responsibility of the administrative department? The responsibility of the administrative department is to plan, to direct and coordinate financial operation of the hospital. It is their duty to plan what they want to do, how they want to do, then direct it, that it should go in the direction that they want to go, so that they will achieve the objectives and goals, and also they can coordinate it, the financial operation of the hospital. Then to prepare work and financial plan and provide fund estimate for programs and projects in the hospital, to manage the receipt and disbursement of cash collection, like the fees for any investigation that the people do, or the fees for hospital bed, for fooding and so on, is being received by the administrative department, that is the account department in the administration. Then to administer personal development program policies and standard, to plan for workshop, to plan budget for workshop, for conferences, and so on, and to give advice on matters affecting policy, enforcement, and administration of laws, rule, and regulation. Then to procure, store, manage, and issue the inventory and disposal of unserviceable hospital equipment and material, and provide general service such as repair and maintenance, housekeeping, laundry, transport, and security. These are all the responsibility of the administrative department. Clear up to here?
Yes, ma'am.
Okay, next we will go to function of different department under the administrative service. See, we have the administrative office. Here, in this administrative office, they direct and supervise the activities and function of administrative unit to effectively deliver quality support services. Like they have the personnel section where they development and administration of a comprehensive manpower. In this personal section, they will plan for the number of staff that they require, the type of staff, their educational qualification, and so on. So in the personal section, they development and administration. It is a department of development and administration of a comprehensive manpower development program, which include recruitment and selection of staff, promotion, training, employee welfare and benefit, manpower planning, and research. Then property and supply section, like here we have the store and procurement department. This department will procure the supplies and equipment needed for the hospital. They will store it, they will issue it, and then they will distribute and dispose of the supplies and equipment to different departments as per the requirement. Then we have also other department, as I have told you earlier, that we have the next is the medical care and patient support. Okay, in the administrative, we have different department. We have also the personal section, we have property and supply section, we have an account section which look after the financial need of the whole hospital, and also we have the administrative head who is there always. Then next we come to the other two function, that is for patient care. Here the main purpose or the main function of the hospital is to care for the sick and injured and restore their health. So hospital as a medical is a medical institution in which the client who suffer from some disease or health problem is being treated and cared. And a comprehensive care is being provided by the healthcare team to the people who require the care. And these clients are being treated according to their priority need, like emergency care, which we have emergency department, then care of people based on their need, like medical care, surgical care, pediatric care, and so on. Then for prevention of disease, this is being accomplished by early screening and detection of risk, maintaining aseptic technique, following the principle of medical care, and prevent the occurrence of certain complication. Then for promotion of health, any person who is maintaining his health can accomplish higher level of health. So in a hospital setting, various aspects of health promotion are taken care of, like health education, supplementation, and regular checkup. Then for diagnosis and treatment of disease, as soon as the client approaches the healthcare team, a complete assessment is done. Afterward, medical diagnosis is made and treatment is started. Then scientific application of mental hygiene and mental therapy, as mental health is an important aspect of healthy person, so clients suffering from stress, mental health problem are treated in a hospital. Counseling is also being given to them. And for rehabilitation, It is a process where an individual is re-educated, particularly where an individual has been ill or injured, to enable them for becoming capable or useful citizen. Example, care of a person who has undergone amputation, how to rehabilitate them. I think you all know about it. You have been in orthopedic department, you have seen the rehabilitation center there, how they rehabilitate the person with different problem. Any question? Then outpatient services are those is a department in which they give services to the people on outpatient basis, where the person will not have to stay in the hospital, but they will come to the hospital just to get their medical treatment and medical checkup based on their need. Then medical education and training is a hospital which provides professional and technical education for health personnel like the nursing and paramedical staff, and also for research. So next we come to the organizational structure of a hospital. Every hospital, whether they are large or small, they have an organizational structure that allows them for efficient management of the department. So we will see why it is important to know about the organizational structure of a hospital. It is important for us to know the organizational structure of the hospital in order to facilitate the understanding of the hospital change of command. We will know how the communication flow, whether from top to bottom or whether in a from side to side. So this shows which individual or department is accountable for each area of the hospital. So the complexity of organizational structure depends on the size of healthcare facility. Like large acute care hospital have complicated structure, whereas smaller institutions have a much simpler organizational structure. So grouping of hospital department within the organizational structure, as you have seen here also, although the hospital department, they perform specific function, but departments are generally grouped according to similarity of duty. Like departments are also grouped together in order to promote efficiency of the healthcare facility. Common organizational categories might include administrative services, often referred to simply as administration, which we have here, the administrative block, and in the administrative block we have different departments which look after the need of the different categories of people or different activities, which look after the different activities so that those activities are being carried out in an effective way. Then we have information services which give information about the data of the hospital. Then therapeutic services, which the hospital ward, which give care to the patient, diagnostic services, the laboratory services, x-ray services, and support services, sometimes referred to as environmental services, or here in our hospital we say as a sanitation department. So the administrative service, if it is business people who run the hospital, a private hospital, the hospital administrator will manage and oversee the operation of the department. He will oversee the budget and finance, establish hospital policy and procedure, and perform public relation duties. That is the administrator. They may be the director or deputy director. Then generally they include the hospital president, but in the private institute they may say it the president, vice president, executive assistant, department heads, depending from one hospital to another hospital. And information services, they will document and process the information of the hospital. What are those documents that they retain with them, and what are the information that they keep with them. They are the admission, that's mean often the public first contact with hospital personnel where the admission procedure is being carried out. Here they check patient into the hospital. Their responsibility include obtaining vital information like the full name, address, phone number, admitting doctor, admitting diagnosis, social security number, date of birth, all insurance information, which you all have seen here in the hospital also they do there. And then frequently admission will assign in-house patient their hospital room. Then they will assign the patient the hospital ward or the hospital room if it is in a private ward. Then billing and collection department, which they collects the patient bill. If it is a private institute, we know that the patient will have to pay for the service they receive. So there is a billing and collection department. Even here in our institute also we have a billing and collection department where for those procedures that the patient have to pay, they will go there. Then we have a medical record department. Here also in our institute, we have a medical record department which is responsible for maintaining copies of all patient record, like all the diagnostic procedure that is being carried out, the patient's condition, the patient progress, the patient status, whatever file of the patient is there is being kept in the medical record department. Then information system is responsible for computer and hospital network, and health education, the health educator, they are responsible for staff and patient health related education. And human resource is responsible for recruiting, hiring, employee and employee benefit. Then therapeutic services, it provides treatment to patients which include physical therapy, provide treatment to improve large muscle mobility and prevent or limit permanent disability. Then treatment may include exercise, massage, hydrotherapy, ultrasound, electrical stimulation. Okay, here stimulation and heat application. Then occupational therapy, the goal of treatment is to help patients regain fine motor skill so that they can function independently at home and work. Treatment might include arts and craft that help with hand-eye coordination, game and recreation to help patients develop balance and coordination, social activity to assist patients with emotional health. Then speech and language pathology, identify, evaluate, and treat patients with speech and language disorder, also help patients cope with problems created by speech impairment. Then respiratory therapy, treat patients with heart and lung disease. Treatment might include oxygen, medication, breathing exercise. Medical psychology, concerned with mental well-being of the patient. Treatment might include talk therapy, behavior modification, muscle relaxation, medication, group therapy, recreational therapy like art, music, and dance. And social service, it aids patients by referring them to community resources for living assistance like housing, medical, mental, financial. Social worker specialists include child welfare, geriatric, family, and correctional for jail. And pharmacy dispense medication as per written order by physician, dentist, provide information on drugs and correct way to use them, and ensure drug compatibility. Dietary department is responsible for helping patient maintaining nutritionally sound diet. Sport medicine will provide rehabilitative service to athlete, teaches proper nutrition, prescribe exercise to increase strength and flexibility or correct weaknesses, apply tape or padding to protect body part, and administer first aid for sport injury. Then nursing, that is the registered nurse or the ANM will provide care for patient as directed by the physician. Many nursing specialists include nurse practitioner, labor and delivery nurse, neonatal nurse, emergency room nurse, nurse midwife, surgical nurse, nurse anesthetist. In some facility, nursing is a service in and for itself. But this at present, we are not having it in our country. But in foreign country, the nursing department or the nursing service is in itself a separate department in which the nurses with specific specialty will carry out their activity independently. Then diagnostic services, which determine the cause of illness or injury. It includes medical laboratory, which study body tissue to determine abnormality. Then imaging, image body part to determine lesion and abnormality. Include diagnostic radiology, MRI, CT scan, ultrasound. Emergency medicine, which provide emergency diagnosis and treatment. Then supportive services include Central Supply Department in charge of ordering, receiving, stocking, and distributing all equipment and supply used by the healthcare facility, sterilization, instrument or supply, clean and maintain hospital linen and patient counts. And biomedical technology is design and build. They design and build biomedical equipment like biomedical engineers, diagnose and repair defective equipment, then provide preventive maintenance to all hospital equipment, pilot use of medical equipment to other hospital employee, and housekeeping and maintenance. They maintain safe, clean environment, cleaner, electrician, carpenter, gardener, all falls under this department. So whatever we have talked here about the function of the hospital, function of the different department, and the organizational structure of the hospital, in which different departments have their own departmental head, and the departmental head will see that each and every staff under him or her carry out their activity as being prescribed or being given for them to do. Any doubt here?
No, ma'am.
No, ma'am.
So the types of organizational structure, there are yes? There are different types of organizational structure, and the type used depend on the organization and its industry. The hospital management structure is a combination of more than one type of organizational structure, and this is typical of most organizations. So here we will discuss about the different types of organizational structure. They are functional organizational structure, then we have divisional organizational structure, we have matrix organizational structure, flat organizational structure. Okay, so we will see this one by one. First is functional organizational structure. When we say functional organizational structure, what does it mean? This type of organizational structure is a structure in which people are grouped by tasks and their function in the organization. Like nurses, we say it, nursing department. All nurses will fall under nursing department, right from the nursing superintendent up to the staff nurse. So under a functional organization, the structure or people who do similar tasks are grouped together based on specialty. So all the accountants are placed in the finance department, and so on for the marketing, operational, senior management, and human resource department. But it is quite commonly used in different small or medium-sized organizations. Such type of, okay, I'll just go through it. Functional organizational structure, you understand that it is a structure in which the people are being grouped based on the task that they perform or on the function of the organizational or of the organization. They are being grouped. The people in that organizational structure are being grouped on the similar tasks that they do based on their specialty. Like nursing, they are specialized to give care to the people in the hospital. Then lab technician, they have their own specialty to do the lab tests and so on. Then next, the divisional organizational structure. Here, the company will group the workers in two teams based on the product or project that meet the need of a certain type of customer. And it is different from organizational structure in that the workers have different job function and tasks, but they all work together. This is used in most of the hospital and healthcare organization. where you have doctors and nurses in different division or department, like oncology department, pediatric neuro, surgery department, but they all work together to achieve the same goal and objectives of the organization. They are known as divisional organizational structure because the people are being grouped based on the product or project that they have to perform and to achieve a certain objective. In functional organizational structure, the workers, they perform a similar job, okay? Those people who perform a similar task or a similar job, they are grouped together in functional. Clear? The difference between functional? In functional, people who carry out the same type of work, they are grouped together in the same. Whereas in divisional, the people here are grouped into a team where people with different specialty and carry out a different job are put together. Like for example, in medicine ward, there is a nurses, there are doctors, there may be a physiotherapist, there may be a lab technician. These people, they form a team and they work together in that particular department to provide patient care and to achieve their goal. Whereas in a functional organizational structure, it is based on the job that the person will have to function, like nurses. They will fall on the nursing department because they have to carry out the same function of giving care to the patient. The lab technician will fall in another department because their objective is to do laboratory tests. Clear the difference?
Yes, ma'am.
Okay. Then matrix organizational structure. It combines element of functional and divisional model into one. The matrix model is a bit more complex. It groups people into functional department of specialization, then further separate them into divisional, project and product. So in a matrix, it combines both functional and divisional. In functional, the people are grouped based on the function that they have to perform or on the job that they have to perform. After that, they are further divided into department of specialization where they have to carry out their function based on their specialization. Then flat organizational structure. It attempts to disrupt the traditional top-down management system of most companies and create a more liberal management system. This management style is decentralized, so there is no everyday leader or boss. Each employee is the boss of themselves, eliminating bureaucracy and red tape and improving direct communication. For example, an employee who has an idea doesn't have to wait through 3 levels of upper manager, that is the lower level, the middle level and top level manager, to get the idea to the key person and take the decision. The employee simply communicate directly with the target on a peer-based level. So flat organizational structure, it eliminates the traditional top-down management system. That means the order should come from the top and the lower level will have to carry out the function. But here in flat organizational structure, each and every employee who have an idea can communicate his idea directly to their target or peer-based level manager and let that manager take the decision. So here the organizational structure, the organogram of Directorate of Health Services, MI, Meghalaya. Here we have the director, we have the additional director. This is an example, okay? Then joint director, MI, joint director for specialized services, joint director for tuberculosis, for AIDS, and so on. Then after the joint director, we have the deputy director, also for different department. Then we have the zonal officer. Then we have the junior specialists and all these. So this is the organogram which we have at the Directorate of Health Services, Meghalaya, so that people will know from where to communicate, to whom to communicate. And institute body or governing body of NEIGHRIMS, they have the finance committee. This is the organizational structure of NEIGHRIMS. The institute body is governed by the governing body, which have a finance committee, academic committee, selection committee, estate committee, hospital affair committee. Then in the governing body, they have the president, then they have the chairman, governing body, then comes the director, and the director, he is the head of the administration, academic, hospital, and all these centers. And below him, in administration, the deputy director administration will look after the administration. In academic, the dean is the head. In hospital, the medical superintendent, and in the center is the chief of the various center that they are having. And in hospital, they have the medical superintendent, the deputy medical superintendent, and head of department, and also the nursing superintendent, deputy nursing superintendent, ward sister, staff nurse, and nursing aide. So this is all about hospital. Do you have any question? Yes.
No, ma'am.
No. So we will end up here. I think it is clear to you because you have been also in the hospital for more than 3 years and you know the different department, you know the different function of the hospital. This is only to renew your or to revive your memory. Okay? So we'll stop here. Thank you.